Morning, everyone. We'll start in just a minute.
Good morning. If I could ask if folks who are joining just want to put their welcome in the chat, put your name and who you're representing, that would be great. We're filling in. Welcome, everybody.
Start just as these are panel members. Just want to make sure they're connected to audio.
Yeah, well, and we'll give it a minute because it's just one after, and I know there are a lot of panel members who plan to join. We're up to 33 participants. That's great. Good morning, everybody.
Commissioner, while we're waiting, if I may just give a
Yeah.
shout out to Maggie and Eloisa for their great work and helping me get connected today. So I just wanted to point that out.
We
Thank
love
you.
shout outs to our team. We got a great team. Thank you.
We're so happy you're here. Glad it all worked out.
Thank you.
Still some people coming in, but
Okay, are we set to keep letting people in? For those of you who just joined, we were asking folks to put their name and who they're representing in the chat. Just so folks know who's here. Not requiring it, but I think it would be great. And if you're representing an organization or a person, that would be great. And before I hand it over to Eloise, I just want to thank the panel members who joined us this week for a work session, and it was really helpful, and we're going to schedule more so that you can keep asking your questions, and it drives us to get more information and will help us. So Eloisa, turning it back to you.
thank you, Commissioner. Okay, I'll get us started. Okay, well, welcome everyone. Again, my name is Eloisa Melendez, the lead planner and manager for the Blue Ribbon panel. Thank you everyone who's joined us today. We're looking forward to another engaging discussion. Today, we will hear recommendations from the systems work group and hear more about their work over the past few months. This past Monday, like the commissioner said, we held office hours for panel members, and we used the time to answer questions and brainstorm solutions around equity and access and workforce and quality. We also had a very helpful public sharing session on system recommendations last Thursday, and we will incorporate that feedback from the field and families as we continue to move forward. And panel members will receive a summary of that feedback soon. As a reminder, the focus today is for panel members to review and provide feedback on these recommendations, not to receive input from the public. We welcome public attendance and are so happy to have so many people interested, and I'll put a feedback form in the chat for any member of the public who has input or comments. And this meeting will also be recorded and posted on the OEC website. Today's agenda we'll spend the first day, part of today's discussion, providing some context to how we have arrived at our current structures and provide context around the goals and guideposts around the systems work group. And in the second half of the meeting, we'll head into breakout rooms to discuss in more detail the preliminary recommendations that this work group has put together to share with the Blue Ribbon panel for consideration to use in developing a strategic plan for our childcare system so that it works for family providers and Connecticut's economy. And now I'll turn over to Commissioner Beth Bye.
Hi, everybody. I'm so happy to be here today. You're stuck with me. I am your expert today as we get ready for systems. Because I have experience as a consumer, as a parent, I have experience as a teacher, I have experience as a program director, as a legislator, and now as commissioner of the Office of Early Childhood. So I've spent some time thinking about how to set the stage for you all as we dig into this systems work. You may have noticed that childcare was in the news this week. I think one day we had 3 articles in the Hartford Courant around the childcare crisis, and you all got a lot of mentions. You're going to solve a lot of problems, and today's part of how we're going to do that. I will also say the interest in this process is very high. On Monday, I was on a call with early childhood providers, and more than 250 providers were on that call asking questions, some of them related to the Blue Ribbon panel. So it's, I think I say every time pressure is a privilege. Certainly, I feel pressure to move this forward. And I think the systems work can be underestimated. Those of you who work in complex organizations know that, it's easy to get distracted by pretty ideas and policies, but that the way to build a system for the future that will flex is to really spend time thinking about the systems. So in your email, I put a quote from Lynn Kagan. Dr. Lynn Kagan is a professor at both Columbia and Yale, and she is from New Haven, and she has spent decades studying early childhood systems in the United States and around the world. So she's also been president of the National Association for the Education of Young Children. And before we started this process, we met with her, and she said, Beth, pay attention to the systems. You need to pay attention to the gears as much as the flowers. And I just loved that. I'd love that turn of phrase by her. So she did in the quote in your email say there are 5 commonalities among early childhood systems that work. One is that there's a strong policy foundation, and it recognizes a unique context that the system sits in and the needs of stakeholders and the public. And we're going to talk about that today. That there are comprehensive services, sufficient funding, and coordinated governance mechanisms. This is an area where Connecticut really needs to make progress. We are in need of improvement. We're doing our best, and many of you serve on some of those governance bodies, but we can do better. Also, that we have a knowledgeable workforce, and that engaged families who can support children. And we talked about that at our last panel meeting, and we're making some progress on workforce. And that there's sufficient information so children are learning and they're getting ready for school, and that it's centered around child development, that it understands children as young children. And another area in terms of Connecticut falling down, but I'll explain some of why that is it requires effective data collection and utilization to improve policies and programs. So if we can get our data system better, I believe in Connecticut, we'll be able to build that kind of flexible system that will work going forward. So those are Dr. Kagan's words, not mine, but I think she makes some really good points. We're doing our best to focus in those areas, but we have to keep those 5 things in front of us. We've sort of artificially broken this work into 5 work groups, 4 work groups, today being systems, but all of them overlap and are intertwined, and at the core are systems. So today we're going to be thinking about solutions. How do we reduce the complexity and increase the efficiency for providers? We'd love to eliminate complexity, but we know there's going to be some, and again, I'll explain that to you today. But all of our efforts come together thinking about how we can improve the system for providers, for families, and for OEC and governing bodies and the State Department of Education. All these, we all want a system that works more easily, with the goal of supporting optimal child development and supporting families, because both families, to help them support them so they can support their children in terms of their understanding of child development, but also so they can go out in the workforce and make a living because we know stable housing, stable income, parents that are in jobs that make them feel fulfilled, make them better parents. And so it's complicated. So we're going to focus in 4 areas today. And Cathy and Jill, thank you for your leadership. You're going to go over these in much more detail. Program enrollment and operations. So, you know, those of you who are parents, my guess is you found out about where to send your child to early childhood from a neighbor. You know, we don't really have a system like we do in public schools, right, Fran, where they walk into the public schools and they're going to be enrolled in kindergarten. So we're going to talk about that. We're going to talk about the existing funding systems. When I was thinking about a metaphor for our funding systems, and I thought about the healthcare system. And I know we have some panel members who work in healthcare. There's so many different ways that money's coming in, and the individual has some responsibility. It's super complex. We're going to talk about how we can simplify that and make it work for families and for our system. And then governance. How do we decide who has the power to make decisions, and how do we make sure there's equity built into that, and that the right people are at the table and have a voice in that system. And then finally, our data and outcome system. So those are the 4 areas that we're looking towards. So it's not just, some of you know I'm part of this Salzburg Global Seminar where I work with about 35 early childhood educators from other countries. And this is not a problem unique to the United States. And there are some social democratic countries that have like a system that is just an early childhood system. But for the most part, in the United States and around the world, these systems are complex because our understanding about the importance of the early years for future education, it's somewhat new. You know, it's really from the 80s and 90s when we could do scans of the brain and we saw those connections happening in those early years. So what's happened is since the 60s, and I'll walk you through some of that, up until now, we keep trying to add things in to fix a system or to add more funding or to address early childhood, each of them with great intentions and each of them with its own rules around funding, around quality, around implementation. So that not only leads to challenges navigating for states, for families, for programs, but it leads to huge data challenges because now you have all these different programs, each holding on to different parts of the data. And I would say, you know, we have a mediocre data system at best. I will say when I was in the legislature, I got so frustrated trying to get outcome information that I passed a bill requiring the Office of Early Childhood to do a regression discontinuity study. I won't go into that, it'll take too much time, but just trying to have something that could tell us the impact of early childhood. It found some impact, but it was not an ideal study. So we're working on items now to address that. And then I'll say, and many people on this call are from the Office of Early Childhood, our team is working so hard to make the system work better, to align the different funding streams, et cetera. But we don't want to confuse alignment with true structural change. And so that's where we're going to be going. Okay. So I'm going to briefly walk you through the history of how we got here. And I've talked about some of this before, but in the 1960s, the War on Poverty started Head Start as a way to help families support young children and get back in the workforce. And that came with a whole lot of federal funds for childcare, and those funds go directly from the federal government down to the local government. And some of the outcomes research on Head Start has incredible findings that early childhood has a 13 to 18% return on investment. So that program still exists, but that was sort of the very beginning of sort of a big systemic approach to early childhood. And then in the 1970s, those of you in education will remember the IDEA passed in the 1970s. So that created an entitlement for children with special needs from age 3 to 22. So now the public schools were like, oh, now we're not just responsible for first grade through high school. Now we're responsible for young children. So now that adds a patch in. So now you've got some kids in Head Start, and now there's this local funding that's required. And as parents demanded that they have their child have the least restrictive environment, these are in virtually every school system now. So in the 70s, we added that. And then in the 80s, the IDEA, which is the Individuals with Disabilities Education Act, it added that children birth to 3 had an entitlement to early childhood services. Now that birth to 3 is an entitlement, meaning the states and the federal government are required to fund services for children. Now, so these don't just layer in some services, it's a requirement. It's very different than a block grant, which is really what's happened since. So you have those 2 entitlements come in covering children birth to 5 and adding pieces to the system. And then in 1990, with Senator Dodd from Connecticut, part of leading, we passed the Child Care and Development Block Grant, which gave states block grants of funds to support childcare. And that is now, you'll hear us talk about the Child Care Development Fund as well. These all are funds that come out of, CCDF is probably the acronym used most in my office because that's where most of our federal funds come, which is out of the Child Care Development Block Grant. So now in the 90s, you layer in a federal block grant that states have to come up with rules to implement. And then very soon, not very soon, but in the mid 90s, welfare reform passed and also said, oh, well, if we're going to pass welfare reform, we're going to pass money for childcare. So no one can be on welfare more than 21 months. And so that was a whole other block of money designed especially for working families. So that created all these rules about who could get in and who couldn't. If you weren't working, you couldn't get those funds. If you were working, you could. And Connecticut, compared to other states, we passed the most draconian welfare reform, some of the most in the country that we're still unwinding. But we were one of the last 2 states, and it's only a pandemic that made it happen, that had childcare funds pay for parents in workforce development. Connecticut had very strict, doesn't matter if you're in higher ed, doesn't matter in your workforce training, you don't have access to childcare money unless you are working. But in the pandemic, Governor Lamont added a stipulation that no, these funds can be used for people in higher ed, adult ed, and workforce training. So that was a good thing. But just to say, Connecticut had very strict rules about who could access the welfare reform dollars. And then in 1996, the Supreme Court passed Sheff versus O'Neill, which the answer that required the legislature to come up with an answer to the separate and unequal education systems. The legislature did not want to pass something that included busing, regionalization, so they passed a lot of money for preschool. So then school readiness came in reaction to that. And so this combination of pathways to funding has really led to a complex milieu. I'm going to ask Kendra, can you share slide 3, please? Much as I like looking at the panel. And then in 2014, Connecticut created an Office of Early Childhood saying, we've got all these different sources of funding and we've got to make more sense of it. So you can see before we had the Office of Early Childhood, how the programs were spread across many agencies. We moved to the Office of Early Childhood, and you can see we still have other agencies that we coordinate with, like we use Medicaid to help pay birth to 3, and we're looking at using that to pay home visiting as well. And WIC is required to stay in Department of Public Health. Otherwise, I believe it'd be up in the Office of Early Childhood. So this was an improvement. Next slide. Okay, so I sort of wanted to close out here by just showing you what this looks like to a teacher, a director, and a parent. So now we've made this single Office of Early Childhood. We are one of the first in the country to do this, and other states are following us. We've probably met with 5 states this year that want to move to this governance model, and I've talked about our governance being weak. Well, our state governance is pretty strong, but then, how do we use local governance to guide local decision making? But if I'm a teacher, I have to interact with all these systems you see on the slide. And I'm sure some of our panel members who are listening could add many others. But there's a lot to keep track of, a lot of different systems to interact with in order to be a teacher. And then the directors who are also trying to figure out the funding, they have even more systems that they are relating to in our early childhood system in Connecticut. And then parents are trying to navigate this. So as a parent, first you have to say, okay, if I make less than 100% of federal poverty, how many parents know if they make less than 100% of federal poverty without someone helping them? Then I'm in Head Start. Or now there's a new rule. If I'm on SNAP, I can automatically get into Head Start. Oh, I don't qualify for that. What do? Do I go to my public school? Oh, the public school doesn't have room, but I can't afford it. Well, maybe if you're lucky, in 56 communities, there's a school readiness liaison who's working with the schools. So the schools may say, see if there are any school readiness programs. But each of those is its own program. So now you get a list of 9 programs that are school readiness programs. Do they have space for me? No, they don't have space. And the CDC, the child daycare programs, aren't really connected as much to the school readiness council. So those are just out there, and parents are just lucky if they find those. And then if you don't qualify for any of those, you may say, well, what do I do now? So you call United Way and find out, yes, I qualify for Care for Kids. So that'll help me pay for childcare. But how are parents supposed to navigate this system? We're going to talk about that today. And we're going to talk about creating a system that makes a lot more sense for directors and teachers as well. So I'm going to stop there. And I could have spent like 3 hours describing all these different systems, but that's not the point. The point is to show you that everybody's interfacing with too many systems, leading to uneven data. And even McKinsey consultants couldn't figure it all out. And now I got SVP spending day and night trying to figure out how to get the right data to give you the best recommendation. So I'm going to stop by saying, are there any clarifying questions before I turn it over to the recommendations? Okay, it looks like you guys are ready to get right to work. That's what we're hoping for. So we're gonna break into breakout groups. Oh no, we're not going to breakout groups yet, not at all. Cathy and Jill are now going to Cathy Lenihan, who runs our grants and contracts office. So she is trying to make sense of this from 150, 200, I don't know, 500 grants, Cathy, to meet all these different funding streams. And Jill has been trying to coordinate our system improvements with the preschool development grant. So they've been entrenched across systems in our office and have spent the past few months meeting with staff and experts to come up with these recommendations. So I'm turning it over to Cathy first. Thanks, Cathy.
Thanks, Beth. And welcome everybody. Again, as Beth said, I am the Director of Grants and Contracts Unit here at OEC. So the work that we put into this is important not only to families, providers, and communities, but it's important to OEC as well. So the systems work group, as you can see, is the third of the 4 interdependent work groups presenting to the Blue Ribbon panel. Our group is made up of internal OEC staff and trusted partners based on their expertise and their lived experience in early childhood education field in Connecticut. We focused on some of the major building blocks of a reimagined system, how it's funded, how decisions are made and by whom, and how the OEC interacts with and supports families and providers, and how data is used across all systems. Our vision is that the systems are enhanced and created through this work should serve stakeholders in the following ways. So for families, we want them to be able to know what care is available to them and how much it will cost, and how to engage locally to advocate for what they need. Beth just shared the complexity that families go through right now. And so our vision for this work group is to make that simpler. For providers, that they'll be able to simply and efficiently access an enrollment system, operational support, and professional development opportunities. and that providers who are part of the state-funded systems will receive funding in a timely way. And then for the local communities, they'll have a governance structures and supporting data to build community-formed programming and assess funding and opportunities to help their communities thrive. So those are the three key things that our work group's vision was focusing on. And the recommendations we will discuss today, for those of you on the panel, you've been through this twice already. They're preliminary recommendations, and we're looking for your input and feedback to continue to build on these recommendations. Our work is not just about developing a plan, but we're working to build input support for the plan, which is why we're emphasizing outreach. We've done the public listening sessions, and we're looking for feedback. And we want you to think of this as a marathon, not a sprint. And what we have to come up with is the first step to getting a strategic plan together with this group later this year. So it's important to note that there are many overlaps among these work groups. As we started, top header of this slide, that these are 4 interdependent work groups. And we intend that these work groups not stay siloed, but communicate with each other and collaborate to finalize a strategic plan for addressing the childcare crisis in Connecticut. Next slide. So here is the timeline. As you can see, it started with the executive order March 17, 2023. And you can see here we are on July 12th, and we're doing our deep dive. And then last Thursday, just previously mentioned, we were able to engage with the public on the recommendations that we will discuss with you folks today. We got some great feedback from them. We had great engagement in those sessions. And here we are, as I said, the third of the 4 deep dive sessions, helping to prepare the panel for final decisions for the strategic plans to address our childcare crisis by December 2023. That's our goal. Next slide, please. So as we've been doing this work, one theory that has guided how the systems work group has conceptualized the different layers of systems has been the Bronfenbrenner's ecological systems theory. As you can see from this theory, it posits that child development is impacted by the multiple levels and environments that surround the child. So if you see in this picture, we've got the child in the center, then it's the family system, provider system, systems that occur in communities, and the systems at OEC. And we have used this theory to consider the way different systems within the broader ECE system impact children and families, and to help us remain focused on centering children and families within each of the policies and the systems that we consider. So as we move through the recommendations today, we hope that you'll help us consider how each proposal might impact the different layers of this system, shown here, with the goal that we are reducing complexity, increasing equity, and providing an a quality ECE experience for our children and families. And with that, I'm going to turn it over to Jill to take you through a few more slides.
Thank you, Cathy. Our goal as a work group is defined here: to build an equitable, efficient ECE system that is informed by current data and that fosters a substantial provision of high quality programs and services for young children and their families in Connecticut. Next slide, please. So as Beth and Cathy have mentioned, our current system ecosystem faces a variety of complex and interrelated issues. The graph that Beth showed you shows you what the different people who occupy this field have to work through. We've identified the following key categories: program and enrollment operations, funding systems, governance, and data outcomes. The following draft recommendations you are about to hear under each of these categories are preliminary and based on current work and promising practices both here and across the country. The recommendations will ultimately be prioritized and refined based on feedbacks from the public. from public guidance from the panel and from stakeholders. They will then be tested for feasible impact. This session is more than just a feedback on what you will see. We need your thinking about solutions. So as you listen and you read, please be thinking about solutions. How can Connecticut address these issues, not just what we should address? Feedback is going to be key, new ideas, and a reimagined system is how we're going to make progress in this area. And now we're going to go into the sub goals that we have for each of these work groups. The first one is program enrollment and operations. Our vision is to create a unified navigation system that allows to be a central point for both parents and providers that will hopefully eliminate some of that complexity and create greater access and greater understanding for families. We're also looking to provide incentives to programs that utilize state systems. So for example, any program that uses the navigation system that we're proposing, an assessment system that is agreed upon, any business supports that we currently offer, and Care for Kids, they would be provided state incentives to improve business practices. We also want to provide resources and supports to providers, and these resources and supports will be based on what providers tell us they need. And these could include things like shared services plans, onboarding support, such as orientation for newly licensed programs. And then we want to assess where changes can be made to our group home regulations so that more providers are attracted to operating group homes, thereby potentially increasing the number of childcare slots for families, particularly for those families who need non-traditional work hour childcare, and aggressively seek subsidized facilities with a focus on facility needs for programs. Can I have the data one now, please? Our data goals are to enhance and integrate an existing data system. So we do have systems that we're currently using. We want to enhance them to support a comprehensive data system for providers that unifies program data and invoicing processes. Again, like Beth said, we don't have a data system that gives us data that we need. So this, not only will the navigation system that we're considering provide us with ease of access for providers and families, it will also provide OEC with data that is needed. We very much want to streamline the process for families to assess childcare information and availability. We want to provide an opportunity for parents to be able to access the care that's in their community that provides subsidy, provides the services that they need. And the goal is to perhaps even create something like a FAFSA where parents only fill out one registration form instead of multiple forms anytime they move programs. We do want to collect common needs assessment data from local and regional governments. This will help provide data to the OEC website, but more importantly, it will provide us with real-time data to understand what the field looks like and where we need to pivot and make change to meet the needs in the field. We also would like to implement a statewide system to assess children, Connecticut's children early learning and development from birth to age 5 that will then be linked to the State Department of Education, which will help with kindergarten entrance and help us leverage existing platforms that exist. And finally, we'd like to create a transparent statewide data dashboard to share aggregated operation data and outcome measures with the field. So our data and our systems work is we're very excited about it. Here's some of the things that we have heard from the field from the feedback session last week. One of the things that providers and experts in the field in Connecticut provided us with was they want us to build on existing systems, especially 211 Childcare and Sparkler. They want a use of a common application that will benefit families and providers. A question for all of us to consider is how to get private programs to engage in these systems, these state systems. And then finally, a key reminder is how families choose childcare is based on relationships and word of mouth. So there are limits to how much data can help without the actual on-the-ground connections that we're seeking to build. And with that, I will turn it over to Cathy for the funding and governance recommendations.
Thanks, Jill. So here are the recommendations for our subgroup, the funding system. We have 5 of them. The first one is to consolidate the number of state-funded EC funding sources right now. So we've got school readiness, child daycare, Smart Start Recovery, and Head Start Supplement Care for Kids to 1. We think this will simplify the process, not just the administrative burden for our providers, but also for families. If we can go from 5 to 1. And, you know, as we did our listening session last week with the public, there was a positive feedback on consolidating these funding sources from the existing 5 to 1. Our next recommendation is to fund programs by classroom based on blocks of time, informed by community needs, right? So right now, funding is by slots and it's done differently. Some folks are paid in advance, some folks are paid after the services have taken place. And we're looking to make it, again, simplify this, make this easier for programs to fund by classrooms and then based on blocks of time. And we'll get into more detail of that a little later on. Again, a lot of positive feedback from the listening section on shifting this funding and funding by classroom and based on blocks of time. So already we've got some really great feedback in the field on this. Our third is to deploy a unified state funding to programs through state of Connecticut POS contracts, rather than what we have right now, which is a current mix of grants. So school readiness get their funding through grants, and CDC have POS contracts. We'd also like to distribute payments directly to programs. We've heard, you know, depending on whether you're a subcontractor, whether it's a school readiness program, you know, sometimes your payments getting to programs are delayed. And so we're looking to see whether we can distribute payments directly to programs quarterly in advance of the service provided. Some folks have that not now, but not everyone. And rather than through contractors and fiscal agents. So again, really positive feedback from our public listening session on this approach. Appoint a regional ECE governance bodies aligned with intermediary regional governance structure and governance recommendations to assess unmet need for high quality ECE by community. And we're thinking every 3 years. And then develop an annual plan for local disbursement of state funds allocated to communities and aligned with demonstrated needs and local assets. There was mixed feedback, just, you know, sharing what we've heard from the listening sessions on creating a regional ECE governance structure. And what we heard is that regionalization is a charged term in Connecticut. So we're interested in hearing your feedback on that today, and we need to continue to explain the benefits as we see it on appointing these regional ECE governance bodies. And our last recommendation in funding is to convert the funding structure to reflect the true cost of care rather than market rates. Next slide, please. Governance. So this was the last of our 4 sub work groups and our sub goals. And we had 4 recommendations in governance. The first is to create and fund a cohesive governance system that covers all towns and provides an opportunity for local partnership and collaboration to allocate state funding. In the listening session, we got feedback on this, that the term governance may not be used widely. So perhaps, you know, thinking about packaging it differently. And it was also shared that local governance is quite strong in some areas. And there will be a desire to keep this. So looking to what's already working, what exists already in communities, I think is something that we're interested in. Second is design and fund an intermediary regional governance structure to support local bodies. Folks wanted to get a little bit more information on that from our listening sessions. They wanted to think about who would be included in this and how things will be communicated and what it means really for the system. Our third goal is to create supports at the state level to bolster capacity of local and regional governance bodies. We have, to have a strong governance body, they're going to need additional supports. And so that is something that we are recommending. And lastly, create a common needs assessment with common data collection across all local governance bodies. And I think one of the key takeaways from the listening session, trying to get to my slide, is no matter what system is designed, no matter what system is designed, they express priorities for the system to be consistent and sustainable, provide the opportunity to build trust, and continue to include providers in the discussion and design, and preserve local individual program autonomy to meet the needs of their communities. I think that's a really strong statement. That's why I wanted to find my notes to share that, because I think that's important for us to keep in mind as we move through these, the recommendations and considerations. With that, I'm turning it to Eloisa.
Thank you. Are there any clarifying questions from panel members before we move into breakout rooms? No? Okay, just checking. All right, everyone. I will move everyone to breakout rooms. I will stay in the main session, so if anyone needs anything, please let me know. Okay. I don't know why. Anisha, I don't know why I didn't hold it. Oh, there you go.
I'd also say to folks who are in our room that if there are things you don't like in the recommendations, please let us know. So we'll knock them out. And we do have a lot of suggestions from the public listening session. So yes, come on in. Okay, we're getting there. We're more than half of the people are back. So that's good. The rain took a break, gave us a little break this week. Goodness gracious. Poor Vermont. I was looking at Vermont, just
devastation. It is receding this morning, though, so that's
yeah. Oh, good.
Okay, I think everyone is back.
Oh, good. Yeah, that all happened quickly. You all came back from that other work group. How'd it go over there? Elena, Kathy, Monisha, who's there? Okay.
Yeah,
First
we heard
session was
some-
great.
Yeah, I
Great.
heard some great ideas, some great feedback and excitement as well.
I'm really taking that, those of you on the panel don't know, but those of you on the systems work group, I don't know how many hours you've met, but it's probably 50 hours trying to get a set of recommendations to the panel that makes sense. And then you sit in a meeting like this and you have 2 or 3 brand new ideas that just seem so, it's like, how do we miss that tree right in front of our face? It was the forest, it confused us. So I really appreciate the feedback that we got today. We're gonna show you the timeline one more time to show you how that these draft recommendations will be folded into future conversations. And as I said in my work group, I know that the brief was so long and there was so much in there, but panel members, please feel free to send us comments anytime. I'm sure you didn't have time to get through it. Things you like, things you don't like, things you want more information about. We were asked for some very specific information in our breakout group, and we'll be working on that for the panel to help the panel understand what is overseeing, how do we change items that we're suggesting? What requires federal approval? What requires state approval? What requires, OEC approval? Those kinds of things. So that was another really good suggestion. So we're going to take those and keep trying to improve this process to give you what you need. So we're at the systems deep dive. The big kahuna, in case you don't have enough challenge yet, is the funding and costs deep dive. Which comes next. And there has been so much deep thought and analysis that's gone into this. And we're really going to need your minds on that. And then we move on to sort of do some culling and decide what are the recommendations we want to move forward with for maximum impact. These recommendations from today, we had a work group this week, which many of you attended. We probably had 15 people there just to get more questions answered and roll up your sleeves. We're going to schedule a couple more of those upcoming, and we'll send you the dates for that. And we appreciate the extra time. And if you can't attend those again, Eloisa and I, Elena, Maggie, all of us are open to input from you, and you can email me and we'll get back to you. If you just say, I really need half an hour to understand X, we will make time to do that with you. We understand there are a lot of acronyms. We'll try to reduce those to get you what you need. So your feedback will be incorporated as we carry on. And I just wanted to thank you for coming. And I look forward to hearing from you after the meeting, however you want to communicate, if you have questions or feedback. And I just hope you all have a great day. And it's not close enough yet to the weekend to say, have a good weekend, but have a great Wednesday, and I will see you soon. Bye-bye.
Bye, everyone. Thank you.